7:45 in Trinidad and Tobago. Let's get a little medical for our final segment this morning, because we want to talk about varicose veins, which are swollen veins that you can see through the skin. They often look blue, bulging and twisted. Left untreated, they may worsen over time and can cause aching and feelings of fatigue, as well as skin changes like rashes, redness and sores. But as bad as it may look, and given its health implications, it's actually treatable. Dr. Nalini Kokaram Maharaj, a radiologist at the Eastern Medical Imaging Services Limited, is here to tell us more about a 5-step program to treat spider and varicose veins. Dr. Kokaram Maharaj, good to have you here with us. First and foremost, I think most people know about varicose veins and so on. Spider veins are the little ones.
Correct. So it's like I was telling you, it's these abnormal collection of small fine veins that are close to the skin surface. They're not medically a serious problem, but it's more cosmetic problem. So you'd find younger age group of women wanting to have clear skin because they wear skirts or opt to wear skirts, and so we want to clear those. Varicose veins, on the other hand, is a more serious medical condition. And as you said before, if it's left untreated, it will progress and can lead
to what? Yes.
Yeah, it can lead to very, very serious debilitating conditions where you have ulcers in the leg. I'm sure you would have seen it. We would see a lot of, and what I'm seeing now more and more frequently in the hospital and in private practice, more and more people letting their varicose veins go untreated, progress onto ulcers. These are those big sores by the ankle, the inner aspect of the ankle, and those, because it's caused by poor circulation, they don't heal. And these patients, because they are not aware of what's available to treat it, they're resigned to just go to the health center every 2 weeks, get dressings, get antibiotics, which is not going to treat that problem. So, and they're happy to live with it. That's not right. I think if people are aware of their treatment options, what they can do, what's available out there, and sort of dispel the myth that we have to live with it, and this is how we age, people would be able to access better treatment and lead a healthier, happier life.
And give us a sense of this what is being offered here by this company, Eastern Medical Imaging Services, of this 5-step program. What's that about?
So the 5-step program, first step, you come into us. Now, not every problem with your legs is going to be veins. It can be arteries. It can be an infection. So you need to be assessed by a professional to determine what is your problem and how severe your problem is. Once that is done, this is where I come in. We have to do...
Because people might say, well, what does a radiologist have to do with all of this?
Right, so this is where I come in order to assess exactly what's going on beneath the skin surface and to see how severe your problem is and exactly where the level of the problem lies in your veins, because remember, we're looking at legs from the groin right down to the ankles. I come in and I do an ultrasound. It's a specialized ultrasound. It's called a Doppler ultrasound, which basically looks at the blood flow within the blood vessel, within the veins, in real time. And I will do that with the patient in a semi-upright position and ask them to do certain maneuvers to put the valves inside the veins under some pressure, because varicose veins usually caused by those valves in your veins that are there to prevent backflow of blood. When those don't work properly, the blood just stays in the feet, pools in the feet, and you get symptoms like swelling after prolonged periods of standing or sitting, throbbing, itching, burning, pain. That's a common symptom patients complain about. And again, left untreated, it goes on to skin changes and the ulcers. So what I do is perform this ultrasound, look at the blood flow, look at the function of the valves at various levels along the leg, and looking at both in the legs. There are 2 types of veins in the legs. There's the veins that lie very, very deep in the legs. That's the deep venous system. If you have clots in there, which is a potentially life-threatening condition, you will also have varicose veins. So I need to exclude that with the Doppler ultrasound and also perform, examine the superficial veins and look at the valves. Each valve is a very precise process. That way I map the veins in the legs and determine where the problem is, grade it, if it's mild, moderate, or severe, so then I can recommend to the vascular surgeon what's the best treatment option for that particular patient.
Sadly, we just have about 3 minutes left, but if we could give a sense as to how affordable is this process, because a lot of the inhibiting factors in relation to treatment is cost and so on. How would you quantify this?
This particular treatment option, because we do it in office, you don't have the need for general anesthesia. It's patient is fully awake, no hospital stay. It is very affordable. In fact, it's half the price compared to other procedures like the conventional stripping of the veins and so on. So patients will find it within their pockets.
But is it a quick fix?
It is.
Is it
is the gold standard actually for treating varicose
quick fix
veins.
means that it will work for a while and then you're back to the problem?
No, actually this has the lowest incidence of recurrence after a 5 and a 10-year period, compared to other treatment options. Like I said, this is the gold standard for treating it now. Medical technology has advanced to a stage now where you don't need to do surgery and stripping anymore. This is an in-office procedure. It's pain-free. We recommend Panadol to go home with. There's no downtime. You have to walk right after the procedure, so you go back to work. The key to success for this treatment is ambulation, walking, keeping your weight within a reasonable range, and resuming physical activity.